This presentation is about etiquette, to be followed by hospital staff, especially nurses. Etiquette is something that is not usually taught in any nursing curriculum. So, what actually is etiquette? Well, etiquette is defined as the customary code of polite behavior. You can consider this as a sort of protocol that should be followed. The two most important rules you should remember are, number 1, smile, and number 2, greet. Now, if you went to a hospital, how would you want the staff to be? Smiling and pleasant, right? We would like to see a smiling face, rather than a grumpy one. And, let me tell you, smiling is contagious. I acknowledge that it may not always be easy to smile. But, at least, fake a smile. Now coming to the next important rule, greet. You can either greet by words, or greet by actions. Or better, by both. So, how do we greet by words? You either say good morning, or good afternoon, etc. You can also greet in your local language. Coming to greeting by action, these are a few examples. Never forget to acknowledge children too. Always greet the children. Treat children as children, and not as patients. Now, no wonder why Obama is still one of the favorite presidents. So, what have we learned so far? Okay, we first learned that etiquette is the customary code of polite behavior. Then, we learned the two important rules: to smile, and to greet. Greeting can either be by words, or by action. Now coming to the next part of this presentation. The ABC of etiquette. That is, the appearance, the behavior, and the communication part of etiquette. In appearance, you have to take care about your dressing, grooming, and posture. Make sure that your dress looks clean, non-wrinkled, and well ironed. Also see to it that your dress is not too dull. If your hospital has provided you with a name badge, or an ID card, please wear it. Also make sure that your hair is well combed and neat, even after a long night shift. The next part of appearance you need to focus on is your posture. Make sure you don't look too casual leaning on the wall, or leaning on the door, or even leaning on the table. Having discussed about the appearance, now we will discuss about the behavior part of etiquette. Remember that a patient is a human being, with feelings, emotions and problems, and not just a case. Your behavior should be appropriate to the time, place and the person. When a patient is nearby, your jokes and laughter might actually offend them. Your behavior should be warm, and should take care of the following points: you should be smiling, you should greet, you should make a good eye-to-eye contact, your behavior should be polite, and you should be gentle with your patients. We have already discussed about smiling and greeting. A good eye-to-eye contact gives an impression that you are concerned and listening. So make sure you don't look elsewhere, when a patient is talking to you. Now about politeness. Do not ever raise your voice, or stare, at a patient. Make sure your body language suits the place. Don't bite nails, or keep scratching. Try to help the patient as much as possible. There is no harm in going out of the way, to help someone in need. Do not forget door manners, and always remember, that your patients have the right to privacy. Try to make the patient as comfortable as possible. For example, open the door for your patient. Always mind your door manners, and never forget to respect your patient's privacy. When you wish to enter a room, knock gently on the door, and wait for a response. Do not bang hard on the door. And, when you leave the room, make sure you close the door gently behind you. Finally, be very gentle. Be gentle with your patients, and while you do procedures, also when you walk in the hospital. We now come to the last part of our discussion. Communication etiquette. When you see a patient, don't forget to introduce yourself. Introducing yourself helps in better rapport building. Be gentle, but clear. Please do not get angry, even if the patient is at fault. Try to understand that all patients suffer a lot of anxiety when in a hospital. So losing temper is understandable. Never hesitate to say sorry at appropriate places. Before beginning any procedure, explain everything about the procedure. And, if you do not know something, tell the patient that you'll get back with an answer. Do not give wrong information. When the patient asks you for something, try not to say no for an answer. Try your best to solve the patient's problem. Never talk anything negative about your colleagues, or about the hospital to, or in front of a patient. Avoid talking about your personal problems with your patients. Follow your hospital policy, regarding informing the results of tests, or revealing the gender of the newly born baby. If your hospital's policy mandates the doctor to inform these to the patients, let the doctor talk about it. Also, never ever tease your patients. And, hospital is definitely not the place for gossip. Do not indulge in gossiping even if no one else is around. Follow all the above said rules of communication, when you are on the phone too. Remember to be very polite over the phone. Do not be impatient. Alright. So we come to the end of this discussion. What have we learned so far? In the first part, we learned the two most important rules in etiquette in a hospital. First is to smile, and the second is to greet. And, in the second part, we learned the A, B, and C of etiquette. That is, the appearance, the behavior, and communication. The take-home points are, it's easy for the patients to lose temper, as they are stressed in a hospital environment. We must understand that, and we must go above and beyond the call of duty. Always imagine yourself in the patient's shoes. Maintain the sanctity of our profession. Thank you.